Hello, everyone, and welcome back to the Upward Spiral podcast with Dr. G and Dr. Fodi. We have an amazing guest who I'm going to introduce right now. This is Dr. Miriam Zylberglait, or Dr. Z. She is originally from Peru, is a triple board certified physician in internal medicine, geriatrics, and obesity medicine, and founder of Virtual Wellbeing MD, which we will be discussing today. She completed a fellowship in leadership education and development, certification as a mental health ally, and training as a chief well-being officer with the World Happiness Foundation. Dr. Z has been recognized for multiple achievements, including Mentor of the Year by the American Medical Women's Association in 2021 and the American College of Physicians Young Achiever Award in 2017. Dr. Z is the author of the #1 best-selling book, The 3G Cycle of Life, The Secrets for Achieving Joy, Meaning, and Well-Being, which has been awarded the 17th Annual National Indie Excellence Awards in 2023 and received the Golden Medal Florida Authors and Publishers Association's Annual President's Book Awards in 2023. And she just published a child's version of the book, The 3G Cycle Quest, The Epic Adventure of the 3G Explorers, which was co-authored with her two wonderful sons. So, Dr. Z, Miriam, thank you for coming on board.
Thank you so much for having me. You guys are amazing. I am so happy to be with you.
Amazing.
It is
So,
absolutely our pleasure to have you.
yeah. So this is amazing. For those who may not know, Miriam and I know each other because we are in a co-venture right now. We are working with the wonderful Dr. Donna Coriel in curating a conference for residents and resilience. And Dr. Gina Marie Papilla is one of our wonderful speakers in our lineup as well. So we are all on board that wonderful upcoming conference. So I think that goes into my first question. And I think this is a commonality, obviously, among all three of us. But, and we've spoken about this before, but can you talk about kind of your more recent passions, especially resident wellness, and what has spurred that for you?
Yes, the word is correct. It's passion. I feel absolutely passionate about this because I believe that we have been teaching medical trainees, and I'm not talking only about medical residents, physicians, but also nurses and all other healthcare professionals to achieve success in medicine uh, while sacrificing themselves. And altruism has been the world #1, right, in our education, and has been defined in a way that is absolutely negative for our well-being and also for our productivity, for our ability to really serve our community and to be the doctors and the human beings that we want to be. So it's time to change that paradigm. It's time to change the way that we see medicine, that we educate in medicine, and that we practice medicine, because right now we are failing ourselves, we are failing our medical community, and we are failing our patients too.
Wow. Yeah.
Yeah.
What does that bring up for you, Dr. G?
I think that's so well said. It's so true. I really resonate with what you said about we are we're doing well, succeeding in our medical career by sacrificing ourselves. And that's really where the issue comes in, because you only can get so far. And it's not just sacrificing yourself, it's your patients, your family, everybody will suffer down the line. And I think that really resonates. And it goes back to even just taking, like, self-care is important for every part of your life. So it's like, if you're not doing that stuff to take care of yourself, it doesn't really, every other part of your life will suffer because of it. So,
And we feel guilty about practicing self-care, and we feel guilty about taking time to, heal or recover or just rest. We have been educated that, that's not allowed, and that actually even a demonstration of weakness, and you are not fit for this profession. And it's painful to see the outcomes, right? Because initially, when you are in medical school, what happens is that everybody around you, because you live in a bubble, right? It's very difficult to be in medical school and at the same time socialize with other people. So suddenly your life goes around medicine. Everybody around you is involved in medicine, and you are in, I was telling this to a pre-med student today, you live in zombie land, right? Where everybody has green hair and you believe that having green hair is normal, right? And being a zombie is normal because that's the only thing that you see. You don't know
So true.
better. And when you don't know what you don't know, really, it's dangerous. And we have been growing in our medical careers, not knowing that we don't know, thinking that this is the only way to do things, feeling embarrassed to actually ask for something different, and feeling tired or feeling pain or feeling sad or scared is just like the most dangerous demonstration of humanity, right? Who will dare to do something like that in the hospital while you are using a white coat? And that has been the end of, the real medicine. We ended uh, killing the joy that we used to have in the past, killing this passion. We are zombies. We are in survival mode in the hospitals. And at the same time, not only, and I agree with you, Dr. G, it's not only that we are affecting ourselves and our families, but the consequences are really affecting each of our patients and in general the community. The mortality rate is higher, the disability rate is higher, the readmission rate is higher, the cost of healthcare is higher because you have doctors or nurses or other healthcare uh, practicing medicine with just their 50% of capacity because the other or less because they are exhausted.
Yeah.
I know. Yeah. And it's interesting. I completed a course recently that I thought was phenomenal. It was called the Resilient Mindsets in Medicine, and it's talking a lot about how, this culture. Well, it reminded me really, so much so that they spoke about it. The culture of medicine has been perpetuated for years, right? Of just, that's made us into zombies, right? Like you talk about, Miriam, that just push through, right? Just, where we had the professors, it was, it was a very interesting point that brought up, we had the professors when you sat down in medical school, look to your left, look to your right, only one of you is going to make it through, just saying,
All of a sudden you're competing with everybody around you.
that's
Oh,
right.
yes,
That's right.
yes. And if
I
you're a
even,
woman, forget about that, right? Because you will get even more pressure because who will be the pregnant one? Who will be the one that will get
Yes.
married and will quit the profession, right? So,
Mhm.
so even
It's so
more for
true.
the woman.
Not to mention you have to deal with hormones and menstrual cycles and all those things. It's
Yeah.
on top of it.
Absolutely. And I will tell you something that is very interesting. The culture has been toxic for a long time, right? And burnout is not new. We started to talk about this toxicity and burnout and many things related to that during COVID or around COVID. But burnout has been there for decades, right? The toxic culture and the discrimination for minorities, especially women, right, has been there forever. It's incredible that in 2024, when we have so many movements, right, in different careers and in different type of businesses, right? Uh, the most, I will say, I don't know, the one that is moving slower is us. It's ours. It's like we are supposedly the smarter people, you know, very educated people. We know the consequences. We know what will happen, how bad the outcomes could be. And the ones that have shown less progress in developing leadership skills, emotional intelligence, appropriate well-being programs, because ice cream, you know, once per month, and a dog to say hello to the residents
Mhm.
every 6 months, and a golf
Yeah,
night once per
exactly.
year is not a wellness program, right? Let's
That's right.
clarify. It's an insult, right? To those that are working so hard every day saving lives. Uh, we don't have anything like that, but you go to Google or you go to any other these big corporations and looks very different.
Right.
Absolutely very different.
I think those corporations have realized that by investing in the people that work for you, you get so much more productivity, right? You get so much better outcomes when you can actually pour into the people that work for you. But it hasn't really trickled into medicine, not quite.
And
I,
the
that's so
reason
true.
is that we have been very, we have not been smart, because our altruism, right, transform us in the yes
Right.
group.
Yeah.
We say yes to absolutely everything,
So
right? We accept everything. It's like, as soon as they will tell you about patient first, you will jump. It's like you cannot do something different than patient first. So you will tolerate whatever. And in the meantime, you have groups, right, that are growing inside of the medical field, formally, right, the nurses, nurse practitioners, PAs, that are less expensive for corporate, right? They rather to pay their salaries than yours or mine, for sure, that are replacing us. So you are less important. They rather to hire 3 PAs instead of hiring you.
right.
And then now they have a supervisor, and we allow that to happen. Nothing, just to
Right.
clarify, I have very good friends that are PAs, very good friends that are nurse practitioners. I am not diminishing their value or the good things that they do. It is just sadly how the system looks. And then you have a lot of people talking about well-being and mental health, right, without formal, appropriate clinical certifications,
Mhm.
that are trying to also take care for good or for business. I will not judge on that. And suddenly the physician is less appreciated,
Yeah.
less respected, right? And
That's a
we
great
are
point.
not anymore, yeah, we are not anymore that important person, right? You were supposed to have a lawyer, and I believe a priest and a doctor in the family.
Yeah.
I believe that the doctor is not important
Yeah.
anymore. You just Google what you have to do and buy something in internet, and you know, and you feel like that need is satisfied, sadly.
Interesting. How much do you think it's a lack of self-value in the
A
physician,
lot, a
right?
lot.
It's
I blame doctor for this.
Mhm.
And I hope I'm not getting enemies today right now, but
Mhm.
but I'm sorry. I completely blame ourselves for this. I mean, I have been in situations where you see the abuse firsthand, and when you see doctors closing their eyes, their ears, and their mouths like monkeys, right? Because status quo is more comfortable than raising concerns and raising their voice and advocating for what is right for you, for your colleagues, for your students, for your patients.
Right.
Uh, and
Instead of just perpetuating the same thing over and over again.
yes, and becoming victims. We are victims. How is that we are
Right.
victims? I
Exactly.
mean, we
That's
have
so true.
probably
I think that doctors, that's exactly right, have become, you said, feel like victims. They've become jaded,
Mhm.
right, by the culture that they're perpetuating, right? So they wear this, oh, I'm going to work this many hours and see this many patients. And that's how, back in the day, we didn't have resident work hours. And they wear all of this like a badge of honor. This is what
I
I
was
used to
them
do.
too. Oh my goodness. You know how cool it was to be 3, 4 days in the hospital with the same clothes, smelling and eating only chocolate and coffee, or Coke, and I will go to my house and I will tell my parents, it's like, you have no idea. I didn't sleep for 4 days. And I was so proud. Now I ask myself, it's like how we are so sick, how we are so confused about, our role when we don't take care of ourselves, when we are not responsible with our body, with our, lifestyle, with our decisions. What we are doing is we are jeopardizing the life of patients. The self-care is not luxury. Self-care is not selfish, for sure. Self-care is a responsibility for any leader that is taking decisions, right? For the president, or the one that is driving a train, right? That you don't want this guy to sleep in the middle of the pilot, right? You will not like the pilot to be proud because he is awake and
For 4 days, right? Exactly. That's
Wow,
so
what a
true.
great analogy.
That's great.
That's a great analogy.
Would anybody be happy? But it's the same way. Would anybody be happy to know that the doctor taking care of them has been awake for 4 days? Absolutely not.
Yeah.
Absolutely not.
You
That's
are the
exactly right.
number 10 surgery of the day. Do you really want to be the last one after 10 surgeries?
Yeah.
Do you want to be that one in the table that, that they will open? No,
But the
right?
thing is
So,
that now it's become almost a joke among the older physicians that they used to do that, and now, as if now residents are
We're
being
weaklings.
babied.
Yeah, we're
Yeah.
like,
And I don't know if you've heard this, Gina Marie
Mhm.
and Miriam, but there's so many times that I've been reminded of why they're called residents, because they used to live in the hospital, right?
yes, but circumstances were very different. And I
Yeah.
am not so old to be, in the generation, maybe in the extreme generation. But yes, I didn't have a schedule protected, especially in Peru. I mean, rules were almost zero. And truly, I mean, if I will spell wrong a word, and at those times we didn't have computers, so you were like writing all your notes on paper, and when you are at the end of the back of the paper, someone finds that you did something wrong, and you then wrecks your paper, and you have to start from zero. I have been there, and the insults on the OR, like I was in that generation, right? For good or for bad. To be sincere, I didn't think that they were doing anything wrong again, right? That was normal. I mean, you are being insulted.
It's just right. It's part, like you said, with the
Okay,
green
like
hair.
I
Everybody has it.
deserve it, right?
Yeah.
I used to have a pillow and a blanket in my car because sometimes it was so late that driving back was ridiculous. So I would sleep really in my car, and I was proud, right? But but the truth is that there was something very different, and that's why I blame the system for this new appearance of burnout. I believe that yes, probably there was burnout and there were, problems and health problems and etc. But there was also joy. The physician was able to control the situations, was his own owner or her own owner, right? You were proud of the things that you were doing. You were very independent in your decisions, and yes, you were staying there for hours saving life, but you had this human connection. Today you spend 15 minutes in a room, probably 10 minutes of these 15 minutes belong to the computer. You have no idea who is your patient because you may not see them again. Insurance will take care of that, and they will change, who you see for the next appointment. So you don't have continuity. You don't generate any relationships with patients. You don't do it even with your friends, your colleagues, right? I remember like being in the hospital was something about friendship. It was like your second family. You will know that you will go for lunch with them, or you will sit even in the floor for 5 minutes to tell the stories. You don't have time. You are supposed to do a lot of administrative things that are very valuable for someone, not for us, but for someone, right? And for the pockets of many individuals. So all these romantic aspect of being a doctor, this feeling of connection, this feeling of being, a hero, or this dopamine and adrenaline of saving lives, right? Vitamin for my soul, that's how I call it. It's not there anymore.
No.
So we feel abused, we feel lonely, we feel not appreciated by our bosses and the system, and not appreciated by our patients either.
It's so true. I remember when I started my fellowship, leaving from residency, I felt so lonely. I missed my friends. I missed like going for lunch. Like you said, it's just like those times in the morning, you connect a few minutes before rounds, you joke around, you're seeing the same people, even the residents, the nurses, like you miss the sense of community. And then I moved to Chicago and I was the only fellow there. I was by myself. I didn't really know anybody. And it takes the joy out of it. It's not fun anymore. It's really not, it's not.
Breaks your heart. We we are humans, right? And humans need interaction and contact with others. And we, in some way, we function based on feedback, right? All our neurohormonal system, right? What keeps us not only happy, but calm, excited, emotionally and physically healthy depends on interactions and the feedback that we receive from everything that we are doing. When everything that you are doing is not enough, and that's kind of the message, right? You didn't see enough patients, you didn't do enough money, you were not fast enough, you didn't close your
And
notes when you
the
were
list
supposed.
keeps growing of all the things you need to be doing, and you never quite finish the list, and you just always feel like there's more and more and more and more. That's such
Yeah,
true.
and you are creating a hole inside of you. And if you are not emotionally intelligent enough to be able to navigate this dark hole and still find time to smell the roses, right? Which I mean, I have been kind of very obsessive compulsive with that. And I used to teach that to my residents. I will be like, did you see the smile on her face when she said that the pain is better? 3 seconds, 3 seconds only, but enjoy, because that's what you have been working for months, you have been studying for years. That smile is your paycheck today. That's your vitamin for your soul. That's your adrenaline, your dopamine, your serotonin, everything that you need
Yeah.
to have the energy to keep going. But if you don't see that because you are so tired and overwhelmed and you are in survival mode, you are in a very bad position where you are in a snowball situation where, you know, this is growing and growing and growing, and your feeling of not being good enough takes you to, to feel miserable and stop enjoying what you love, because we love medicine. We didn't select this. I mean, you want to make money, and there are many other ways to make money. This is love. We go to medical school because we want to help, because we are curious, because we want to make the life of others better. Right?
How do we then bring the joy back into medicine, right? I know that's the golden question, and how it's probably multifactorial here, right? But how do we bring the joy back for our trainees from, we talked about this on our first episode, G and I, how many medical students are already thinking about how to pivot away from clinical medicine, right? And it's unbelievable. So it's starting at the medical student level, but how do we bring the joy back into it? The joy of not just the profession, but what we're doing for our patients.
Yes, it's absolutely a complex question. I would love to have the answer. Probably I could get a Nobel of I don't know what, but right, I could get something like that. I will be very
The
famous
Nobel
after that.
Peace Prize,
Yes.
probably.
But maybe, yeah.
Happiness and resonance.
I I will tell you my suggestion. And my suggestion is go back to the purpose, right? To the basics, to the simple is to remove each of us from our victim position, recognize our value, recognize our ability to take decisions. Nobody has a gun in our head.
Right.
Nobody's forcing you to do the things that you're doing that you hate to do. Nobody's forcing you to stay where you are. You can always say no. You can always do different. You can always move to another place. You have that right. That's number one. When you know that you are your own owner,
Right.
I believe that removes a lot of the pressure because we are believing that we are puppets and we are acting as puppets. We are not.
Yeah, it's exactly what you said about the doctors being happy to be in hours in the hospital years ago. It was because they were in choice. That was their choice to be there. They weren't there because they needed to meet a certain quota. They were there because they felt called to be there. And at any point they could leave, but they didn't want to because they felt compelled to be there.
We didn't want to. You know the happiness of being part of a miracle.
Yeah.
I remember the hospital where I trained was very poor in Peru, very like connected to the best medical school there, but the hospital was super poor. So we didn't have enough ventilators, or we didn't have enough dialysis machines. And you will have to select really who goes for it and who doesn't, right? Type of like the deja vu of COVID, right? For you guys in the United States was like, oh, this is impossible to believe that is happening. For me, it was reality. Well, I was training in a place that was poor, right? That was reality. But instead of letting people die, what we used to do is to use an ambu, right? And push, and you will see 3, 4 of us, medical students, residents, right, staying for days, taking turns in the hospital just to push and keep someone alive. And the feeling of being part of that, the feeling of maybe pushing enough so now there is one ventilator open for that individual and that person could be alive. I mean, I still have
Yeah,
chills,
me too.
memory
Yeah.
of really being part of that magic, right? Medicine is, I mean, it's science, but it's art and it's love and it's passion and it's magic. And when that is removed from you,
Yeah.
it's discouraging, it's disappointing.
It's empty. It doesn't have the fire like when you connect with people, that magic that happens when you feel like you're connecting with another human.
And it's hanging on to those reminders, I mean, like that's when I was precepting residents, one of my first jobs, I tried to always find those reminders because I could sense even the residents getting a bit jaded by the profession, and it happens. And, for example, we had one patient, it was in a federally qualified health center. So many of the patients really appreciate the care they were receiving. But I'll never forget one patient who, we just went over the plan with the patient, what we were going to do for them, right? What we would do for her. Just that's it, and I was with the intern, so I had to go see the patient with the intern, and we just went over the plan. She was so appreciative of just that we were taking care of her and thanked us a million times over, right? And the intern was so confused, and I explained she appreciates that we're taking care of her. We're taking the time. This is our profession to take care of her. I was like, hold on to that feeling because that's why we're doing this, right?
And that's what will keep you alive, right? That memory, right? It's like the taste of the most delicious chocolate in your mouth, right? It's
That's
like
right. I love that. I love
waiting
that.
for the next bite,
Yeah.
right? And but you need to be alert and oriented, like we say in medicine, right? You need to be actively looking for those moments. If you're so busy in your computer, in your phone, in running around like a chicken without head, you will miss it. So you need to be actively looking for that moment, that smile, that hug, that thank you so much, right? That really brings us joy. And the second thing that I believe that is very important goes the other side, and is to educate the community. I believe that it's time for the community to know who is actually the bad guy in this story, right? And who is, and I don't want to use the word victim again, right? But who is the hero using a white cup, right? And trying to advocate for them. Because we are the face of the healthcare system, right? The patient don't see the CEO or the CFO that is not willing to give them money, or the pharmaceutical that is getting this $10,000 or $20,000 injections, right? No, they see you or me, right? So you are the bad person.
Yeah.
You didn't authorize that. You didn't prescribe this. You don't want to help them, right? And you are seeing them for 15 minutes only. We have nothing to do with that. We are as miserable or more than what they are, right? We are like suffering with all this. So it's time for the community, the patients, to know that we are in the same page with them, that we hate what is happening, and for them to be allies. So instead of coming and insulting us, go please sit with the manager and make a long report of why you are so upset with the visit, and how you will change doctors or healthcare systems or insurances, right? If things are not different and you are paying for a visit to be evaluated, so you know what, you will stay until you are very well evaluated. So your doctor has to see you for 30 minutes or 1 hour. Why? Because you deserve it, because you pay an insurance and a lot of money for that insurance, and you have the right. So when patients will start removing themselves from their victim situation, when they go to the doctor knowing that they will be abused. It's like I see when my parents-in-law or people that they get surprised when they are treated well. What's wrong? You are supposed to be treated well. Nobody should be bullying you in the clinic or in the hospital. So we need to educate the community about their rights as patients. They are not victims. They are, you don't go to a restaurant when the waitress insults you and the bill is so high and the food is horrible. Do you go back?
Oh, it's so true. I tell people this all the time when medications don't get covered. It's like, call your insurance company, like argue with them, talk to them, because you're paying good money every month for these things to be covered, and they get to decide what's covered, what's not covered, even if a doctor decides that it's indicated and it would benefit you. And we can only do so much on our end with prior authorizations and all these things. And it's like,
they don't know.
No, yeah.
The patient is clueless. They have no idea. When I talk with patients now that I have the privilege, right? And I explain to them the reason why I am not taking insurance, right? And I am a concierge doctor, which is more difficult for me. Believe me, it's easier to be in an environment that everything is set for you and you have all this administrative support. And when you decide to jump out, right, and you do it to serve them, I explain to them, this is why I do what I do, because in a different way I have no control. It's like, or I am a puppet of the system, or I quit medicine, or I create my system. So I create my system. I went to medical school. I came to this country to do everything again. I will not quit. The system will not win. I am the one that will win. I do not accept anyone to tell me that I don't want, or I don't like, or I will not be a doctor. I love being a doctor. And it has to be in my way. in the way that I believe that my patients deserve, and in the way that I can go to sleep tonight and feel proud of myself. And my kids can ask me when they come from school, was a good day? And I can say with a smile on my face, it was a good day, instead of crying because I felt miserable because I was working, in a way that was not representative of my values.
You know what it makes me think about too? You know, if you're in trouble, right? You're getting robbed and you call 911 and the police come, right? They don't ask you if you have life insurance. If your house is on fire, right? They don't ask you what your insurance is before they put the fire out, right? They just do their duty and protect and serve, right? As amazing as they are, right? Why are doctors who are also taking care of people, why is that not a service to the community and instead has become this monetized conglomerate, right, in the world, right? It's unbelievable. We are of service to the community, right? That's why for loan forgiveness, there's something called public service loan forgiveness, right? We're providing a service to the public, so the government's like, "We'll help you forgive that gigantic loan that could buy a house," basically, uh, because we're serving the people. But why are we serving the people, but are at such a expense to the people and can't serve the way we deem fit, right? You see the firemen get to the house that's on fire, and then someone's telling the fireman, "Oh,
Knock everything down, they're breaking windows.
yeah," they're not telling them, "Oh, no, 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 don't use that water. It's not covered under their insurance. No, no,
Yeah.
no, no, no. You got to use this fan instead."
Yeah.
Like, no one's telling them that. Do you understand? Like, this is what I'm trying to say. We are of service to the people, just like policemen and women, and just like firemen and women. We are of service to the people at the end of the day. So the fact that people have seen us as dollar signs and are now dictating, like you said, right? The CEOs and the CFOs and everyone who has the hand in the $10,000 and $20,000 injections are dictating how we have been trained for 4 years of medical school plus how many years of residency and fellowship, how to take care of people who aren't the people who were trained to do so is unbelievable.
You don't have, I don't think that you have a lawyer as a chef in a restaurant,
Right.
right? As saying the cookers how to cook. That will be interesting, right? I believe that we are the only group that is directed by people not trained in what we do. And I would love some of the CEOs, CFOs, and let me tell you, I know some of them that are amazing. Don't let's not generalize. I mean, I want to be fair, right? Because this is not something to generalize. You have amazing individuals. I have people today that come from the C-suites that are advocating for reforms in the healthcare and advocating for physicians. So this is not everybody, but many of them are suffering from burnout too. And they are also puppets of the same big corporate system. So now we have, it's like the Wizard of Oz. It's like we have no idea.
Who's in control? That's so true.
Yeah, it's like we just don't know really. It's a monster with several heads. We don't know really. I don't think that anyone is happy today. I just to be fair, I don't think that even the C-suites are having fun today, because what they are confronting is not good. And again in the news, right? And sadly, it's not in the news on TV. It's in some of the good journals, right? Are where you see the big, I will say, illegal probably, or corrupt, or I don't know, the mess up that is happening inside of hospitals is like it's really serious. Uh, I don't think that anyone is happy. And let's face it, the CEOs, They are humans. They will have to use their own hospitals, and their families will have to use. This is a big mess. This needs to be fixed. It's time for all of us to stop being victims, to start being proactive, to be accountable for what we do and what we don't do, and to create bridges between the different stakeholders in the healthcare system, right? Where we can start rebuilding the mess that we have been created for the last decades. Because right now, if you go to a hospital, forget about the economics and the restrictions of insurance, like all the obvious, but just focus in human capital, right? In the individuals that produce or that have some kind of function in the healthcare system. Today, you go to an emergency, and around 65 to 70% of emergency doctors or nurses are burnout. Mm-hmm. So even if you turn a coin, you have more probability of getting a healthy, happy doctor than if you go to the emergency. Probably 70% of the cases you will have a burnout team or doctor or nurse or all together. That means that this group of people are exhausted, less motivated, and performing below average.
Wow.
And that's the individual that will take the decision of, you have a C-section or a normal delivery, I open your heart, or do just a catheterism because you are dying. You have, something in your brain, I need to open your head or not. You go to be in the ICU or not. I send you home with an antibiotic, or you stay because you are septic. So you have individuals that now burnout is a diagnosis, a clinical diagnosis, right? It's in the ICD-10, meaning that has a clinical consequences, right? So you have people literally sick, 70% of them taking decisions that may affect not only your quality of life, but maybe if you stay or not alive. Wow. After they see you.
Wow.
If that is not a public health crisis, if that is not an emergency, I don't know what it is. Because any of us, we are at any moment using the healthcare system.
So true. So it's kind of scary to think, because we're doctors, but our family, like you said, they go to the emergency room. You bring parents, grandparents.
You could children, go, you never
right?
know. A car accident, I hope never, but a diagnosis of something. Any of us, even doctors, nurses, and CEOs, we are, at risk of needing the hospital, needing the emergency, needing the doctor. And if you have 65, 70% of them being burned out, and you have 60% having depression, and you have 11% thinking about suicide during the last 12 months, and 400 dying by suicide every year. And if you add to that alcohol abuse and drug abuse for coping, as a coping mechanism, I will try to avoid going to a hospital and being sick. And these are my colleagues, and this is myself. We are talking about ourselves. We are talking about our friends. We are talking about our tutors and mentors and, and students. This is a public health crisis.
I couldn't agree more. And I think I could speak for Gina Marie the same. And to end that on a positive note, as long as we have amazing advocates like you, Miriam, I think we're headed in the right direction. I think we'll get there. We only get there together. We just need to keep advocating, really developing actionable steps to get us to the right place as physicians and trainees, and really show our trainees and students that there is light at the end of the tunnel, and we're gonna, we're aware, we're shedding light on this, and we're gonna get there. And I think that's what we need to focus on.
Yes. And it's in our power. It's in our power. I think that's the important part, right? It's about, like you said, doctors stepping out of the victim mentality into our power, taking back control, and we're in control of this. We absolutely can turn it around.
Yes, and I want to say something that is very important. People like you, I am in the, in the older generation, but you guys, you are this new generation. You guys have the power. You guys are the ones that will move the needle, hopefully into the right direction. And you are the ones that will be training these young physicians, right? That right now they are losing hope. There is hope, right? And the hope is in seeing people like you, young physicians, caring and dreaming with something better. So I believe that you are inspiring. What you guys are doing is amazing. And I hope that more people and more doctors and more healthcare professionals will keep this flame inside of them of how much they love medicine, how much they like to help, and to have their purpose very clear, even during the dark days, right? Because this purpose will be the light that will allow them to go through the dark tunnel and to see at the end more light for all of us.
Yeah, what I'm constantly doing is, trying to shed light on, mental health awareness for my students, showing them that there's so many options for their career, because at the end of the day, you know, they have to be happy with their life, and there's more than just this profession. So they have to take care of themselves and make sure that they mold their career into what they enjoy. So, I try to also remind them of why they're doing this, why that, Krebs cycle is important, and why, why it's important to learn the Weber Renee test and all these things, and then just explain and give them that clinical context of, this is going to be someone's life that is dependent on it, and remember to remind them of the purpose and relevance of what they're learning and how rewarding this profession truly is. And we just got to keep doing that and working together on improving the profession, because I think everyone here in this talk really cares about it.
We are lucky people, and I believe that we are forgetting that. How many individuals can say that every day they are touching the life of someone, or many, that they are saving lives, that they are changing the direction of many people, that they are learning something new, being part of innovation, being part of a group of people, having adrenaline and impacting the world with everything that we are doing. We can be doctors doing research, education. We can be doctors doing social media. We can be doctors in the operating room. We can be doctors in so many ways. We are lucky. We should be proud of ourselves. We should embrace what we have, and we should be, we should enjoy it. I mean, 30 years later, I can still feel this passion for what I do, and I believe it's possible, and I believe that means that it's possible for many of us and for all of us.
Yeah. And I think that's what the new generation of physicians need to see. They need an example. We need to show the example that this profession, you make it what you want it to be, and you can enjoy it, and you can thrive, and you can also have a life and family and everything on the outside too. It's all integrated.
Absolutely. It's possible.
I always think about, and that's why it was wonderful I got to train with Gina Marie. There were so many days where Gina Marie would come in and remind me of the little things that were so important to making our day positive and then positively impact our patients. She'd come in a clinic morning and said, I got up a little extra early so I can get myself a cup of coffee and feel ready for this day. And I went to the nice coffee place down the block, and like she was like reminding me, like, just taking care of yourself, that self-compassion. And she would remind me how much happier she felt that morning, and she brought it to her patients. And like, you feel again less jaded, less victimized, and more appreciative of what your patients bringing to you, and understanding, and more compassionate, because you're just starting your day well. So I think Gina Marie always taught me self-compassion, and it was so important. Those little things during the day, how important they were. And
that's her
yeah.
mindset, right? And that's the right mindset. We need to set our mindset for enjoying instead of destroying. And we cannot control what happens outside. We cannot control the system. Believe me, I try to change it. Almost impossible. One individual will not do it. It's collective effort and will take time. But what you can control is how you react to the system and what you allow others to do to yourself. And I remember repeating myself, they can take my job, they can take my salary, they can take my cute office. They cannot take my knowledge, they cannot take my values, they cannot take my skills, they cannot take my passion. That belongs to me.
Beautiful.
I think a
That-
lot of times as physicians, right, you feel like everything could be taken away from you. You're afraid that everything, but in reality, everything you need is inside and really can't be taken away.
Absolutely.
And I think the tagline for this episode is going to be enjoying instead of destroying, because that is so very true. And I think I agree with Gina Marie 100%. That was beautiful, Miriam. Very good.
Thank you so much. You guys
Yeah.
are amazing and keep doing amazing things. Again, I don't think that my generation will be the one that will push the change. We will be, hopefully, a lot of people like me will be supporting you guys. But it's your job to make things better and for yourself, because you have many years to go and you can decide what you will be doing with your life in medicine. And I believe that we need to enjoy it. Medicine is beautiful. It's, it's a gift. It's a gift. We are lucky people.
Yeah, that's beautiful. It's like purpose in it, like you were saying about purpose. If your purpose is to create a better environment in medicine for the next generation, because we know it literally, you could change the world that way. If you change the doctor, if you change the system, you change that ripple effect of how many people you can affect is mind-blowing.
Yeah.
100%.
And remove, we need to forget about just being the doctor full of skills. We need to create leaders in medicine. We need to create individuals that have the emotional intelligence, that understand this healthcare system, that know how to talk about human capital and have conversations with a CMO or a CEO, a CFO. We cannot train anymore the physician that was in the
Right, that's
office
like
and
tunnel vision. Yeah, it needs to be
no, it's a
blind
leader.
spot.
It's a physician leader. That's what we need to create. Physician leaders able to be sitting on the table and taking decisions, because it's our job to take decisions. It's our job and our
Miriam,
responsibility.
Love that.
wow. You've left me mostly speechless this entire episode, I'll tell you that. And Gina Marie can attest that I usually talk way too much. So,
Maybe I talk too much. I am laughing. I'm
I just
sorry.
wanted,
So
no, and I
much.
think Gina Marie can attest to this too. I think I just wanted to sit here and listen to what you were saying. That's how amazing it was. So we are so happy to have had you as our very first guest on the Upward Spiral podcast, because this was amazing. G, any final words on this episode before we wrap it up?
Just thank you so much. And thank you for sharing, reminding us of our purpose as physicians, but also as like leaders, and to step into that it is our responsibility. Like we have the ability to change things. It's very inspiring.
You can do it. I believe that all of us, we can do it. And thank you so much for allowing me to sit with you guys. I always say that I am a vampire. I love to be with young kids like, like you. It's like I still feel the excitement and I still feel this, emotion that you guys have. We don't forget about that. It's like in some way, my kids always say that I am the girl, like I am a girl adult, right? Because I keep my heart like as a girl. But keep that heart inside of you, right? As physicians, as humans, remember what makes you happy. Remember this room inside of you that makes you keep going. I believe that there are so many good things that we can do. Don't settle for, with things that are comfortable. This is not a question of comfort. This is a question of what is right and what is not, and what we deserve and what our family and our community deserve.
That's exactly it. It's not going to be comfortable, most likely.
Oh no, believe me. I mean,
in order to, a lot of times to achieve those things, you have to step out of what's comfortable and what feels safe.
Yeah, and that's part of grow, and that's why I like more the term grow than resilience, because we don't need to be just resilient at this time. We need to be able to really transform ourselves, like, that from caterpillars to butterflies, not just to keep being alive like a caterpillar for the rest of the decades. We really need to transform in butterflies and expand our wings and fly as leaders, because if not, our effort will not be enough. And we cannot do this by ourselves. This should not be an individual effort. We should be collaborating, working together, building together, right? Not a competition, but really, a collaboration between all of us, because all of us, we are suffering, and our families are suffering, and our patients are suffering. This should not be a question of ego. This is a question of, integrity and values. And I believe that that's something that needs to be clear when we educate physicians, young physicians in medical school, who you are as a human, because there is not a good doctor if there is not a good person.
And I love what you said before, right? Let life be like a bonfire, right? Because community, that sense of community, is why we went into this too. And what spurs change is community together. And I think that's a fantastic way to end this. But Miriam, thank you so much. This was unbelievable.
Well,
Thank you, guys. My pleasure. Thank you so
Yes.
much for inviting me. A pleasure to be with you guys.
This was episode 2 of the Upward Spiral podcast. See you all soon.